I would like initially to ask you to briefly explain to our viewers and listener what exactly CyberKnife is and how it does relate to more conventional techniques.
So CyberKnife is a radiation platform. This is a brochure. And basically what CyberKnife is it's a regular radiation machine or a linear accelerator that's been miniaturized and placed on a robotic arm. So the advantage of it is it's intelligent. It can actually track the movement of the prostate. It's not a doctor. It doesn't know what the prostate is. So what we often do first is we put 4 little marker seeds called fiducials into the prostate. That's a penny, so you have a frame of reference. They're tiny little, they're smaller than a grain of rice. It's like a much easier version of the biopsy to get them in there. I do probably about 10 to 12 a week. Basically what we do is we numb up the skin of the perineum. That's the flat skin between the testicles and the rear end. We numb up the rectum. And by putting the markers in, CyberKnife has these imagers here that are built into the floor of the machine, which function like eyes. So if you look closely, so this is a model of the prostate. And if you look right there, you see that little black dot right there? That's about the size of one of the markers. So as the prostate moves, which it will, CyberKnife is tracking those marker seeds with an accuracy of less than a millimeter, which is like a piece of hair. So we're radiating less of the bladder, which sits on top of the prostate, less of the rectum, which is where my fingers, which sits behind the prostate, and we're now able to give the radiation faster. Typically, we can give the radiation in 5 days, where historically we did it up into 45 days. So we're able to give a faster, more precise dose of radiation to the cancer and less radiation to the normal surrounding anatomy and get the patients done in 5 days. So it checks pretty much every good box, and we're actually giving a better dose of radiation to the cancer. So historically, with older forms of radiation, we would typically give a dose of about 7,500 to 8,100 centigrade. For the listeners, that doesn't really mean anything. But when we do CyberKnife, when you translate the doses out, we can have that discussion with alpha, beta, things like that. We're giving a dose that's about 15 to 20% higher to the cancer and less radiation to the normal surrounding anatomy. So it's checking a lot of good boxes cancer-wise. We're giving a better dose, we're radiating less normal anatomy, and it's much more convenient for the patient. So they can get back to their lives in a week as opposed to 7 to 9 weeks.